the ideal holiday season does not include a trip to the emergency room. Yet each year, thousands of people end up there. Joining us now to tell us more about staying safe this holiday season is Alex Price, charge nurse at Sandoval Regional Medical Center with the University of New Mexico. So, Alex, the holidays, are they more dangerous for people? Do things just go haywire during November, December?
They can. There's a lot of people who have more trouble during the holidays because they're just not used to their schedules being changed. And a lot of people have more time on their hands, so they try to come into the emergency room for things that are more routine. But a lot of times it just doesn't work out so well. And of course, there's a lot of holiday trouble. They run into more dangers with more issues that they wouldn't normally have faced during the rest of the year. So a lot of it does seem to depend on what they're used to.
So now you were telling me something a few minutes ago. We were talking about flu, and you saw a lot of patients coming into flu. I would think that going to urgent care, that would be like the first step. So is there a secret that I don't know about? Is it faster to go to the ER, or do you recommend going to urgent care?
It comes in two problems. One, the flu itself isn't usually dangerous for most people. It can be for some. Some people do generally need to come to the emergency room, and the types of strains and that kind of thing changes. A lot of it is people are already on the edge. Maybe they have chronic medical problems already. Maybe they got other things going on in their lives, which is making it more difficult to get medical care. And so you can just have the flu, but then suddenly it makes your congestive heart failure worse. So that's where the flu is directly a problem, but it can also be indirectly something that brings them in as well. And so even though they go to the urgent care, suddenly the urgent care will notice that their blood pressure is high, and they need to get that taken care of, or they'll pick up on something they weren't even expecting, like heart rhythm changes or something else like that.
Okay, so I guess on a case-by-case basis. Now, speaking of, what are some of the more common ailments that you see present in the emergency room this time of year?
There's like three different types of things. We see a lot of people who have trouble with pets, animals, things in the home environment. We see a lot of people trying to get new things taken care of because they suddenly have a break in their work schedule. And so they'll suddenly say, I've had this cough for 6 years, can we get it seen now? The problem with that is they're coming in at a time when both the volume of the people coming in and the things that we're finding wrong with people is generally increased, just like you said, during the flu season, other issues like that.
Yeah, absolutely. All right, so now, I know that we've spoken to different doctors, and they say, and correct me if I'm wrong on this, December 25th, Christmas, one of the highest days for heart attacks. Is that right?
Yes, depending on how much you want to get into it. As a broad generalization, yes. There are more heart attacks. It's probably related to just fat and sugar, more or less, but increased stress, increased traveling, long distance traveling. A lot of little factors all add up to more people having heart attacks. But if you actually try to nail it down, like in journals and studies, it's not that straightforward. But yes, that more people run into trouble. Number of people getting into trouble increases, but also how serious they are seems to increase. What we call the acuity of patients increases as well.
Well, so obviously, Alex, it's always great to talk to you about this, but no offense, we don't want to see you during the holidays.
No.
So what do you recommend we do to stay out of the emergency room this season?
A lot of times it's something very simple. The number one thing, if I was going to make it really bullet point, would say try not to get routine medical care done in the emergency room. The holiday seasons are not the best time to do that. It's very difficult to get medications refilled, some types of medications, so it would be impossible. And because you can't see your doctor on December 25th, if you come to the emergency room to try to get the same type of care you would at a primary care doctor, the time's going to be shorter. We have to juggle patients around a lot more. And we have to focus more on the actual emergencies, which means that for a regular hospital visit that you couldn't get done, it's going to be harder for us to get it taken care of appropriately in the emergency room. The other big stuff is always around Christmas season, the power tools, propane torches, pets, big one, dogs, people not used to family dogs, that definitely increases during the holiday season.
Gotcha. Okay, so just be vigilant. Make sure you get all your ducks in a row before the big day. For more information on how to keep yourself safe this holiday season and the University Sandoval Regional Medical Center, head over to casa.com. Alex, always a pleasure to see you.
Pleasure, sir.